I want you to close your eyes and imagine. Imagine it's in the middle of the night and you startle awake, crammed into the confines of a dark boat. Imagine as you huddle closer to your family and wonder if what lays ahead will be better than the nightmare you escaped from. Imagine a new life at the cost of leaving behind everything you know. To live, to survive, to escape. Imagine, real hard. Got it? Now open your eyes and welcome to the Greece refugee crisis. It's no secret. Thousands of refugees are arriving in Europe every week after fleeing from war, leaving behind their homes and loved ones, bringing only what they can carry, walking by foot for hundreds of kilometers, spending their life savings to board an old and overcrowded boat to cross the Mediterranean Sea in search of safety. Some of them arrive alive and healthy, and some of them don't. Syrians, Iraqis, and Afghans have taken shelter on various Greek islands, where they sit and wait for their turn to make the trip to Athens, and after, hopefully, a European city that they can call home. With border control tightening in countries such as Austria, Serbia, and Macedonia, the traditional routes taken for those seeking asylum have been restricted, creating a backlog of immigrants forced to either wait in extreme temperature conditions or seek other dangerous means to reach countries such as Germany.
So this is the so-called graveyard, or the life jacket graveyard. I don't even know how many, I would say maybe anywhere from 500,000 to maybe 700,000 life jackets, which majority of them are probably all fake. I don't think I've ever experienced such a thing. Look at that. So here's from one end. Just gonna show you from this end to the next end, and it just piles and piles and piles of life jackets. And if you want to see, this is the craziness. They're little foams. This is what the life jacket's made of. Yeah.
We need your help. Our mission is to provide adequate health, dental, educational, and psychological support to all waiting refugees. We currently have a mobile outreach clinical team, a mobile dental service, and continuous educational meetings to help volunteers identify sick and vulnerable refugees. Our trainings include basic emergency response, basic life support, and treatment for hypothermia. But medical support is not enough. Alongside physical well-being, mental health is also of a paramount importance. We aim to provide psychological support for all struggling refugees who have endured horrifying traumas. As a small group of independent volunteers, we support a number of organizations. With all of our efforts, we have provided many refugees with clean clothes, underwear, tents for shelter, soup kitchens for food, shoes and jackets for protection. But despite all of our efforts, it's simply not enough. In an era where most people are connected by a mouse click, we have become disconnected to the plight of those desperate for our compassion and support. I ask you one more time to close your eyes and imagine. Imagine it's in the middle of the night and you startle awake, crammed into the confines of a dark boat. Imagine as you huddle closer to your family and wonder if what lays ahead will be better than the nightmare you escaped from. Imagine a new life at the cost of leaving behind everything you know. To live, to survive, to hope. Open your eyes. The time for imagining was then. The time for action is now.